think there are a lot of questions about the variants and especially the Delta variant. Prime Minister Boris Johnson of the UK postponed the UK's reopening plans by about a month because of concerns over the Delta variant. Is that of concern to you? And how do you think that factors into how we think about the reopening in the US?
Well, the parts of our country that have high levels of vaccination should be in really good shape. And if you've been vaccinated, I don't think you should have a lot of worries about the Delta variant. The vaccines are showing themselves to be highly effective so far against the Delta variants. Um, if you're living in a part of the country where there's a low degree of vaccination, or if you yourself are not vaccinated, you're clearly vulnerable because this is basically COVID-19 on steroids. It grows, it spreads easier, it goes faster, you need less exposure to get it. And so, you are facing an even starker choice about whether or not to get vaccinated and protect yourself or be more exposed to this variant. And, I think I know there are people out there still making the decision about whether to get vaccinated, but it's a great opportunity for people to talk to their doctor and make that decision.
So that's a great point because fortunately we know the vaccines are very effective against this variant. But on Sunday, the former FDA commissioner, Dr. Scott Gottlieb, said the Delta variant could become the dominant strain in the US, which could lead to new outbreaks in the fall. So given the UK's decision, how big of a concern is that for you? And what do you think Americans should be aware of? Do you think it could become the dominant strain in the next couple of months?
Well, it looks like it will be. And when we have as long as we have a dominant strain that the vaccine is highly effective on, then for those who are getting vaccinated, we should feel good about it. But this is a vaccine that will become more dominant. Thankfully, the spike protein is one that we will be able to reach with our highly effective vaccines. So I think we can expect in the fall that if you're in a community, say in the Southeast, where penetration rates of vaccines are lower, and there are things like indoor weddings and other things, you will see outbreaks unless we get more and more people vaccinated. And I think by then, we should have good news out of the FDA about the Pfizer and soon the Moderna vaccine being fully approved. And when that happens, I hope to see many more people continue the road to vaccination.